Hello everybody, this is Dr. Jacob Lilly here again, and today we're going to be talking about chiropractic care. What exactly is it from a very broad general sense, and how it can be used to help heal you in an all-natural, non-pharmacological way, and essentially help facilitate the body's natural healing response. Okay. Now the general population just doesn't really have a great knowledge base in terms of what chiropractic care is, unfortunately. I partially blame the chiropractic profession as a whole because we don't do a fantastic job of educating people. That's why I chose my practice to be longer appointments where I get to, sit down with my patients, really explain what I'm doing, explain what's going on with the body and how it's going to help with their specific issues. And it's why I'm not the biggest fan of, 5-minute appointments and, just that whole part of chiropractic care and even just the whole Western medicine model. With chiropractic care, okay, it really boils down to one specific philosophy, which is the body's natural or innate immunity in terms of how it's supposed to heal itself. Now, the greatest example of this is, let's say you are, playing outside and you get caught on some bushes and you lacerate the skin, aka, get a cut on the skin and it bleeds a little bit. If you were to do nothing for it, provide no antibiotics or whatever, and just kind of let your body do its thing, it'll heal, right? It'll scab up, it'll, take care of the infection, usually through some local inflammation, and then it resolves, and then the scab gets better, and then eventually it just falls off, and then new skin is replaced, okay? That is what we call the innate healing system of the body. The body just knows how to heal itself. That is one specific example of every system in our body, right? That was specifically the organ system of the skin, but it does everything else in terms of, your liver, your pancreas, your joints, the ligaments in your spine, muscles, all of that. All has this capability to heal itself, okay? Now with chiropractic care, we're essentially facilitating or help kind of activate or promote that natural healing response. It's an all-natural modality that we do with the chiropractic adjustments and soft tissue treatments and scraping and cupping and ultrasound and laser and all of these things, okay? It's essentially boils down to helping the body heal itself. There's a lot more that goes into that. As chiropractic care starts to kind of push towards this more evidence-based research model where we're having actual research studies showing the effectiveness of chiropractic care with neck pain and back pain and things like that, we're discovering a lot about it, okay? One of the biggest things is this pain gate theory. Essentially what it is the nociceptor fibers, right? The nerve fibers that, sense pain and kind of relay that information to the brain, and your brain interprets it as pain. That's just one specific nerve fiber, okay? And it's very slow in conducting that information up to the brain. There's other fibers called mechanoreceptors, as an example, that also transmit information to the brain and provide it, information. It's data, right? And your brain interprets it. Now with chiropractic care, one of the cool things is this pain gate theory, where when we provide an adjustment, we're providing a mechanical stimulus, with the, force of our hands and pushing on the joints and things like that. We're actually able to stimulate these mechanofibers, these mechanoreceptors, okay? Now, remember what I said about nociceptors, those pain fibers being really slow to kind of go up to the brain. Well, mechanofibers or mechanoreceptors are a lot faster at transmitting information up to the brain. So what this pain gate theory essentially boils down to is if we're able to stimulate mechanoreception or stimulate mechanoreceptor fibers to transmit information up to the brain, we're able to overload the spinal cord and overload the brain with so much mechanoreceptor data that it actually blocks the pain receptors from ever getting to your brain and ever getting interpreted by the brain. So what I like to describe this to patients is the Jedi mind trick of chiropractic care. If you're in acute pain, that's because nociceptive fibers are being activated, right? Once we're able to adjust you, it's very common that people walk out feeling immediately better because we're able to kind of mess around with that nervous system a little bit and kind of play a trick on the brain to essentially block that pain. Okay, so your brain doesn't recognize the pain. This is also why a big part of my practice and a big part of exercise is so important. Okay, because when we're exercising, when we're providing movement, let's say we're doing a bicep curl, we're essentially activating millions and millions and millions of mechanoreceptors to transmit information up to the brain. And what does that do? I just explained it. It blocks pain fibers, okay? So that's why I like to utilize chiropractic as essentially like a window to kind of break that pain cycle. And then we need to add other things to it, like exercise, like e-stim, like ultrasound, like laser, to help that body heal naturally and continue to open up that window of pain-free life. That, in a nutshell, is one, how I like to practice chiropractic, but also the research behind what chiropractic does. We've been able to discover that through research. For specific conditions, as a chiropractor, we're, for the most part, focusing on any type of musculoskeletal issue, right? So that means nerve pain, like sciatica, radiculopathies, musculo, which is muscle, so any type of muscle strain, your hamstring pulled while playing soccer, strained a muscle because you got in a car accident and now there's muscle spasms associated with that, and skeletal, which means bone/ligament, right? So any type of ligament sprain, so like an ankle sprain, any type of perturbations to the spinal joints, any type of disc injuries in the spine that can cause other issues. We primarily deal with that. Now with chiropractic, there's other kind of like subdivisions that we can get into that help maybe specialize with certain things. But what it boils down to is the nerves, the muscles, the joints, the discs, and the ligaments, okay? And if you combine all of that in a bigger overarching umbrella, the nervous system, okay? We're really playing a big role with the nervous system, okay? Brain, the spinal cord, all the peripheral nerves, all the spinal nerves, all of that stuff. And if you really think about it, the nervous system is essentially what makes us, right? Our brain is our consciousness and all of that stuff. We're able to facilitate certain stimulations for the nervous system, which is essentially what makes up everything. The nervous system, the brain, the spinal cord controls every system in our body, every organ in our body, every cell in our body is somehow connected to the nervous system. So if we're able to maybe stimulate change through the nervous system, we're potentially maybe to affect everything in the body, okay? And that's a little bit more the philosophically based part of chiropractic where it originally was founded in. Now, if you look at this chart behind me, you might not be able to see it, but over here, we're talking about its specific innervations of, where the nervous system goes in our body and how it kind of interacts with all these organs. I do believe there is some merit to that. However, it is very hard to prove that scientifically. So I kind of like to keep it in the back of my head, but I don't really put too much stock into it personally. There's a lot of other chiropractors that do, and that's on them to practice how they want to practice. I try to be as much evidence-based as possible, really working on active care, rehab exercises, facilitating core strength for any lower back injuries, neck strength for any type of neck injuries, a lot of like rotator cuff strengthening exercises for shoulder issues, etc. With chiropractic as a whole, we need to continue to remember this idea that it's the body's natural healing response that is what's curing you. It's our job as a diagnostician, as a practitioner, to get to the root of the problem, right? What is actually causing this issue? And how can we positively affect this for your body to heal itself? A very good example is sciatica, okay? Sciatica is a real thing, but it's often misdiagnosed and even overdiagnosed, especially self-diagnosed. The reason we say this is because it's very easy. People kind of have an idea of what sciatica is. Therefore, if they feel something that's similar to it, they're like, boom, I know what it is. I go see my chiropractor, okay? Here's the thing. Sciatica is often misdiagnosed, like I said. It's most of the time actually coming from your lower back. If you're actually getting referral or radiating pain into your butt or into your legs or into your quads or into your knee or even into the bottom of your foot. If you're having symptoms that go out and kind of shoot down or kind of radiate down, and it's kind of like this large area down into your legs or into your glutes, most of the time it's not actually true sciatica, okay? And there is a little bit of a difference, and I'm one of those people that has to separate the two and really get serious about this, because the treatments will differ depending on what the diagnosis is. What most people think sciatica is, which is what I just described, is actually what we call radiculopathy, which means it's referral pain, radiating pain, maybe some weakness in certain muscles, some numbness, some tingling, things like that. However, it originates from the spine and not from the periphery, okay? Meaning it's in the spinal column, right? It's maybe your L5, your L4, your L3 or whatever, versus sciatica, it's the sciatic nerve, which starts when it exits the pelvis and all of the spinal nerves come together to make the sciatic nerve. The reason I'm very serious about this is because that will change how we treat the problem, okay? And this is where we're kind of circling back to, it's my job as a practitioner to get to the root of the problem, okay? Because if we don't get to the root of the problem, what the actual issue is, the treatment will be wrong, you won't get better, you'll be spending a bunch of money, and the results won't be there, okay? Maybe a little bit, but not fully. Most people who have sciatica, as an example, actually have a radiculopathy, where that nerve issue, that radiating pain, numbness, tingling, etc., is actually coming from the lower back. Now, this changes the treatment plan because we'll actually have to see what's actually causing the radiculopathy. Is it a tumor in the spinal cord? Is it a disc injury? Is it some sort of anterolisthesis where it's kind of choking off on that nerve because the segments are pushed forward and it's kind of shearing that nerve? Or is it in specific cases where, very rare cases where the nerve is just inflamed for whatever reason, right? Maybe there's an infection, or maybe there's a surgery that never got better and there's an infection there, right? Those are less likely scenarios, but it is possible, okay? So we need to know what is causing it, aka the root cause of the issue. And we'll take this example that, what if it's a disc injury? That disc bulge or disc protrusion is kind of hitting that nerve, and every time you move a certain way, it's kind of pushing that disc material out and kind of irritating that nerve and inflaming that nerve chronically. That's when you get that chronic sciatica. In this case, it would actually be radiculopathy. Take that case and compare it to sciatica, where let's say there is like a true piriformis syndrome, where there's a tight muscle that's compressing the sciatic nerve, and that's what's causing those symptoms to kind of go down into the leg. How would we treat this one, the radiculopathy that's caused because of a disc issue, versus this sciatica that's due to tight muscles? Well, in this case, the radiculopathy case, we would most likely adjust it pending any red flags that are, positive or negative. Maybe throw you on a decompression table to help open up that disc space, open up that joint space. Maybe there's a little bit of arthritis involved and things like that. And then also do some exercises, right? Because if there's an inflamed disc that is problematic because of certain positions, certain postures, certain movements, certain activities, we want to be cautious with doing things that might provoke those symptoms further, thus delaying the healing process, okay? So there's a lot that we do there. Versus the sciatica person, we might want to work on the muscle, right? Again, in this particular case, if it's a piriformis syndrome, like a true piriformis syndrome, generally we want to work on that muscle tightness that might be compressing that nerve, okay? We might also want to throw in some nerve gliding techniques, right? To help get that nerve mobilizing through that tight muscle, so when that muscle does tighten, it doesn't compress it as much and that nerve is able to at least move a little bit more, thus decreasing the risk of any type of inflammation of that nerve. There's obviously a lot of other things that we can talk about in terms of biomechanics, right? Like, why is the piriformis always so tight? A lot of the times it's because of lack of hip stability and glute strength and core strength, and maybe some postural issues that, are altering that, okay? So you can see how there's, one thing that's happening, right? The symptoms down the leg, the numbness and tingling, two different diagnoses, two reasons as to why those diagnoses are different, and how the treatment plan will alter that, okay? Now, relating this back to chiropractic, it's an all-natural approach that doesn't require any type of pharmacology that might be causing some issues with the liver or the gut and things like that that might lead to other issues down the road. It's an all-natural approach to help heal that issue. If we're adjusting you, that might help, again, with the pain relief aspect of it, right? We throw you on the decompression to help heal the disc injury and help get that disc bulge to kind of push back into where it's supposed to be and not out close to the nerve. And then we start giving you some exercises to stabilize that area so it decreases the risk of re-injuring that disc. So that is how we can effectively use chiropractic as a tool, an effective tool to help manage back pain. But really what it is facilitating a healing window that your body can heal itself in. And our job is to help open up that window as much as we can for as long as we can to make sure you're not in pain ever, really, okay? Now, in some extraneous cases, there's people that are in chronic pain, and that's a whole other topic where we talk about chronic pain science and how it changes the brain and alters white and gray matter and all that stuff. That's a whole nother topic for another day. From a very general outlook, this is a perfect example of how chiropractic care can be effective with treating certain conditions depending on the correct diagnosis and depending on the right treatment plan. Okay? But the gist of it is that it's an all-natural way of helping the body to heal itself. Hopefully you guys all learned a lot as to why chiropractic care works, how it works, and how we're able to effectively help the body heal itself. If you find that you're one of these people that is dealing with some of these issues, leave a comment below or reach out to me on my Instagram or subscribe to this YouTube channel, because we're going to talk a lot more about these issues in depth and kind of going forward. And if you're looking for someone who's trustworthy and cares about you and doesn't spend only 5 minutes with you with your appointments and is with you from beginning to the end of treatment, let me know. We can schedule something and get you the care that you need, okay? Without further ado, thank you again for watching, you guys. Take care, have a great rest of your day, and go see your local chiropractor.